Hyperglycemia. Introduction. Insulin unlocks the receptors on cells so that glucose can enter. Select true or false. Correct. The receptors on a cell are like doors, and insulin is what unlocks the doors so glucose can enter. People with type 1 diabetes do not have enough insulin in their bodies, so their blood sugar gets too high. Select true or false. Correct. Without enough insulin to unlock the receptors, glucose cannot enter cells to make energy. Type 2 diabetes is when there are not enough receptors but there is enough insulin. Select true or false. Correct. People with type 2 diabetes have too much glucose in their blood because it cannot enter the cells since they do not have enough receptors. Which of the following may cause hyperglycemia in a person with diabetes? Choose one of the following options. 1. Eating food high in carbohydrates. 2. Infection, illness, or surgery. 3. Stress and low levels of exercise. 4. All of the above. Correct. Untreated hyperglycemia can lead to. Choose one of the following options. 1. Cataracts. 2. Dehydration. 3. Ketoacidosis. 4. All of the above. Correct. If hyperglycemia is not recognized or treated for several years, it can cause problems. Even mild hyperglycemia can harm the brain, kidneys, and arteries. What treatments can help keep blood sugar levels under control? Choose one of the following options. 1. Checking your blood sugar levels often. 2. Eating right and exercising. 3. Taking your medicine as directed. 4. All of the above. Correct. Thank you for using Explain.